Hello, this is Dr. Steele. Today I want to talk to you about a subject that is well known. Well known because it's one of the number one killers of all of us as we get older. Is hypertension, also known as high blood pressure. In high blood pressure, as you know, like any other system, if you have a high pressure in any pipe, or in this case, our vessels, they can rupture or they can make it difficult for the blood to flow freely through the heart, especially when the heart is attempting to compensate for that high blood pressure. The heart needs to work more for sending the same value of blood because of high blood pressure or increased hypertension. And also, it's a circuit. So not only the heart is having a hard time moving blood, but also the filters of your blood, especially the kidneys, suffer because that filter, that blood pressure is also altering how the kidney functions. And just like the kidney, when we have kidney problems, most of the time we may have, or most of the time we have, retinal problems, problems in the eye, because it also affects the blood flow inside your eye, behind your eye, in your retina, in those vessels. Of course, it can also alter the functions of your brain. It can also alter those vessels because of high blood pressure. And I'm giving you all these symptoms because, excuse me, all these sites, because these sites are the main places where you have symptoms. Vis-a-vis, if you have high blood pressure, some people may have headache, dizziness. Vis-a-vis, that is, if you have high blood pressure in the heart, sometimes you have shortness of breath because the heart having a hard time pumping that blood out, and the pressure goes back to your lungs. And of course, you may have, in addition to that, altered mental status if the blood pressure is really high because, again, it affects your brain and visual disturbances. So I'm not saying everybody's going to feel everything. What I'm saying is that high blood pressure is a silent killer at first because we don't see it because it's insidious. It's gradually your blood pressure goes up, either because you have genetics that predispose to that, or because you have a diet that is not the most healthy diet that increases your blood pressure, like eating a lot of salty foods or drinking a lot of alcohol. Another example would be also the things that you consume without knowing, like power drinks, can also increase your blood pressure. So the silent killer, because like I said, it's insidious, slowly but surely can be detrimental not to your brain health, as I said, your heart health, your eye health, but the overall you is gonna suffer. So it's important to recognize that because you need to get tested. And I would advise for young people at least once a year, but once you start getting 40 plus, especially when you're 50, I think every 3 to 6 months you need to check your blood pressure at least if you have no history of hypertension. But if you have a history now, you need to treat it. Not only do we need to take medications for it, but also we need to adjust how we eat. And I always recommend the Mediterranean diet because that diet low in sodium, one of the factors that could increase your blood pressure. And of course, weight control, right? That's important. And avoiding all any recreational anything like alcohol, drugs, and especially also things that we think is there are not that dangerous, like power drinks and so on and so forth. Another thing is I want you to remind you that if a patient has hypertension, rarely do they have a hypertension emergency. It's more common to have a hypertension urgency. That means your blood pressure is high and you don't feel anything, but you go to the doctor or you take your blood pressure at home and it's greater than a certain number. Let's give you that number. The blood pressure is greater than 165 over 95. If you have that blood pressure, that's an urgency that needs to be treated with pills most of the time. But an emergency is when you have high blood pressure and also you have symptoms, which I already mentioned some of them. The most important ones are shortness of breath, altered mental status, severe headaches, chest pain. If you have any of those symptoms, that's an emergency. You need to go to the hospital because we need to treat you with IV medications, intravenous medications. So keep that in mind. When in doubt, go to the hospital. If you don't feel good, something's off. In addition to that, remember that the medications can only take us so far. You need to adjust how you eat. You need to exercise because that also lowers your blood pressure. And also, you need to also realize that your mental state, your mindset can also alter your blood pressure. If you're under a lot of stress, if it's related to your relationships, your work, your finances, all that can lead to that. And we're doing all this because we want to avoid, again, those end organ damage. The severe end organ damage are, as you already know, heart attacks, strokes, visual change, meaning losing your eyesight, and so on and so forth. So we want to reduce the risk for those, especially heart attacks and strokes. Well, that's my talk for today. Get treated. Remember that patients like ourselves that don't have diabetes, less than 140 over 90 will be a number that we want to get to. And patients with diabetes, we want the numbers to be 130 over 80. And I don't want to get into detail, but it's because one of the main problems with diabetics is that they already have some established vascular disease that needs to be better treated. We need to lower the numbers even more. Take care of yourselves and remember my saying, the greatest wealth is health. Take care. Take care. Talk to you soon.